The high demand for children's medication is leaving parents scrambling to treat their kids.
And we are joined now by Connecticut children's pharmacist Joanna Young to talk about this issue. And Joanna, first, thanks for joining us.
Yes, thank you for having me.
So first, quickly, tell us again what medications are in short supply and what do we think is causing the shortage?
So there's actually a lot of medications that are difficult to obtain. So ibuprofen liquid, acetaminophen suppositories, even albuterol at times are difficult to obtain. And it's a little difficult to determine the actual cause, but likely it is due to an increased demand due to the respiratory illnesses such as RSV. And in Connecticut, there's been a lot of reports of having difficulty obtaining ibuprofen and acetaminophen.
Joanna, should parents stock up on things like Tylenol or Motrin, as you were just talking about? I have young kids, and this is something that my doctor's office has been talking to me about because everyone's kids have been sick for the last couple weeks.
Right. So it's definitely smart to be prepared. But if you're stocking up because we're worried about fevers associated with respiratory illnesses, that may not be necessary.
Okay, and Joanna, what are some of the alternatives here? If people can't get Tylenol or Motrin, what else could they try?
So if you're unable to get Tylenol or Motrin, one thing you can definitely consider is going to some of the smaller stores. The other options you can do is looking for the generic brands, so ibuprofen or acetaminophen. These contain the exact same ingredients as Tylenol and Motrin, and so you can definitely consider those. Also talking to your pediatrician or pharmacist to see what other options they may have. There are chewable tablets and dissolvable tablets for both ibuprofen and Tylenol. And so those are some things that the pharmacist and pediatrician would be able to walk through what works best for you and your child. One recommendation I do have is do not use adult doses. These doses for most of our children are going to be too high and can unfortunately cause severe side effects. So definitely talking to your pediatrician or pharmacist to see what will work best.
And infant medications versus children's medications, also different dosage, right? The infants is more concentrated, I was told.
Yes, they can be. So definitely checking with your pharmacist or pediatrician first to ensure that you're giving the correct dose based on what product you have.
And just one last question here. Some parents may struggle with this. It might be 3 o'clock in the morning and your child has a fever. At what point should you bring your child to the hospital with these respiratory illnesses, whether it's fever or belabored breathing?
So one thing to just keep in mind, most fevers do not need to be treated with acetaminophen or ibuprofen. And you may not need to go to the hospital just for a fever. So one of the big things is if your child is 3 months of age or younger and they have a temperature of 100.4 or higher, definitely talk to your pediatrician as soon as possible. Other situations is when your child has had a temperature of 102 or higher for over 2 days. Calling your pediatrician. And then the biggest one that you had brought up with the difficulty breathing is if they have a fever and have other symptoms such as abdominal pain, severe lethargy, if it's an infant, and decreased wet diapers. Those are some ideas of when you may need to consider emergency room or urgent care. And then of course reminding the parents, you do know your child's best. So if there are any other symptoms on that list and you're worried about your child, definitely reaching out to the pediatrician or going to urgent care and emergency room can be considered.
Important advice. Joanna, thank you very much. Very timely, top of parents' mind right now, that's for sure. Appreciate it.